Scoliosis affects 1 to 3% of children. It's more prevalent in girls than boys, particularly in girls aged 10 to 13 years. Scoliosis is not painful, and hence smaller curves go unnoticed. Hence, routine school screenings or regular checkups with pediatricians provide opportunities for the early detection of scoliosis in children. Minor scoliosis curves usually don't require treatment, but patients with severe spinal curvatures do not respond to bracing, therefore surgery may be necessary to realign the spine. After scoliosis surgery, the initial weeks at home can be challenging. To make things easier, the following steps to be followed for the smoother recovery. Create a schedule for daily tasks and share it with caregivers. Arrange transportation for follow-up appointments and errands. For children and teens, plan a gradual return to school, starting with half-days. Use a rolling backpack instead of a heavy one to avoid injury. Communicate with teachers for accommodations, like the extra time between classes and special seating arrangements. These steps can help ensure following scoliosis surgery, it's crucial to avoid bending, lifting, and twisting movements. Refrain from bending your back to pick things up from the floor. For the initial 2 weeks, post-surgery, steer clear of lifting anything heavy. Additionally, minimize twisting motions to protect your healing spine. Every scoliosis surgery recovery is unique, so it's important to take doctor's advice. Typically, patients can be discharged after 3 to 7 days of surgery, barring any complications. Initially, rest is important, but supervised mobility exercises may begin with assistance and follow the home care recommendations as per doctor's advice. In the first 2 weeks, it's important to have support from friends and family for daily chores to prevent infection. After 3 to 4 weeks, patients may feel energetic and gradually return to work or school. At 6 weeks, a follow-up appointment will determine readiness for more demanding activities, with X-rays at 12 weeks to assess progress. Between 6 to 12 months after surgery, most patients can resume normal activities under the guidance of their doctor. Post-op follow-up is very important because the patient recovery needs to be monitored to check for stiffness and check if structure is valid for patient's body and age. For a growing child, this is very important, as implant needs to be changed after 2 years due to skeletal growth in the patient.